Keynote-048 is an important practice-changing trial in head and neck cancer. This was a trial conducted in patients with metastatic head and neck squamous cell carcinoma in the first-line setting, and it explored the role of the immune checkpoint inhibitor pembrolizumab as monotherapy and in combination with chemotherapy, compared to the decade-long standard of care, which was the extreme regimen, which is platinum, 5-FU, and cetuximab. And it was looked at in three subpopulations, two populations based on PD-L1 expression, using what's called the combined positive score, which looks at PD-L1 expression in immune and in tumour cells. So there's a group with a score greater than 20, greater than 1, and it was also looked in the total population. So the key findings really were that in the monotherapy, compared to the extreme regimen, it improved overall survival significantly in the patients with PD-L1 CPS greater than 20 and greater than 1, which represents about 85% of the population, and it was non-inferior in the total population. It had a somewhat lower response rate, but the response duration was substantially longer, and it had a very favourable toxicity profile compared to the chemotherapy combination of extreme. The pembrolizumab plus chemotherapy combination actually improved overall survival in all populations, the PD-L1 greater than 20, greater than 1, and in the total population. The response rates were similar. There was no significant difference in progression-free survival, and the adverse events were actually similar between the two arms. So this really establishes that for the majority of patients, pembrolizumab, either as monotherapy or in combination with chemotherapy, will become the standard of care for these patients.